start a new job and you got to pick between PPO and HMO health insurance, but you have no idea what that means? Let me explain. So PPO stands for Preferred Provider Organization. HMO stands for Health Maintenance Organization. The acronyms don't really matter. It really matters that both plan types have a network of doctors. And in the case of an emergency, both plans cover you the same. So you can just go to the ER. There is no networks. You just go to the ER no matter what plan you have. However, for anything else, primary care doctors, specialists, physical therapy, skilled nursing, you name it, on a HMO plan, you must be in network or you do not have coverage. You're going to pay full price for any doctors that are outside of your HMO network. On a PPO plan, though, you can go outside of the network. You usually have a higher deductible and you pay more, but you do have access to those providers. So if you just want to see one doctor outside of the network, a PPO might make sense, as long as the doctor is willing to charge the insurance. The last difference is referrals. So on a HMO, that health maintenance, they want everything to go through your PCP. So they require a referral to see a specialist. However, on a PPO plan, they do not require a referral to see a specialist. So you can just go. Now, the specialist, like your neurologist, might require the referral, but the insurance plan does not. The last little thing I want to mention is that sometimes when you look at this, obviously the PPO has some great benefits, but it's also usually more expensive. And I've seen plans that have huge $10,000 or $20,000 out-of-network deductibles. So if you know that you would absolutely just stay in network to avoid a huge deductible, and if you just want to save money and don't want to pay higher premiums, an HMO might be totally fine with you. However, if you hate the idea of having to get referrals, then that extra premium for a PPO might be worth it.